So how
Yeah.
can like GPs navigate through this? The consultation fees. There's a cap to it. You can't charge too much. It's only like what, 30 ringgit, 50 ringgit.
It's now 20 ringgit because most of these TPAs are now owned by a lot of these TPAs. I think the major TPAs are owned by a certain firm, which also runs the clinics. They also hold a lot of these clinics. And when you are under someone's jurisdiction and when you are under someone's power, you have to play by their rules, right? So we at the Chaos Sky Clinic, I was like, nope, I'm not going to take any TPA. We used to have someone called Break Alert, and I used to get all these unnecessary MC hunting people, and I was like, cut off. I don't need this. And then I don't want to have any insurance panels because they want GPs, right? And I don't do GP stuff. So I was fully into functional medicine. So the GPs don't really, the what you call it, the TPAs don't really work well with that. And they will try to dictate and say, you can only charge 20 ringgit for what? For like an hour and a half or an hour of consulting. I don't think that works. So, and they've actually not allowed for some blood tests to be done as well. They say that this is not covered, this is not covered. So the patients that you get are also going to be someone who's not looking to improve their health, but someone who's just like trying to like come there for an MC or just a basic blood test. And you make your niche. All right. So for GP clinics, the only way that I see out of this is to be original with what you do in terms of talking to your patients, how you interact. And in fact, you have to upgrade your knowledge. A lot of GP clinics complain about how pharmacies do blood sugar tests, cholesterol tests, and all those. And they're like, oh, they are doing this and all those. Well, in fact, a lot of countries around the world do not allow doctors to have a dispensary and dispense medications. The doctor's work is to diagnose and prescribe. The dispensing is done by pharmacies. So if the pharmacies were to go in the same line, they can complain about how doctors are selling medications over the counter or prescribing and selling the medications in their center. So this, I feel, also made the doctors to become less of a clinician and more of a drug pusher.
Is it the challenges you saw when you moved to private? One is like what you mentioned, sales target, and then now you have to push for drugs to make that sale target. So is that one of the challenges you see in private healthcare?
In GP, in non-specialty GP clinics, yes, they have to make somewhere something, right? So that is the thing. So if you are not niche, you're not specialized. I see some of them have gone into wound care and stuff like that. Fantastic. Find your niche. You have to do that. Or else it's going to be very difficult. You have to be another GP clinic. And for my question is, I've seen a lot of GP clinics shut in this past few years, especially after the pandemic, right? What makes you different from the other person? You have to be different. You have to find your niche. Either you do things like wound care, you do another field which I'm finding. I'm asking the young doctors, like everyone is jumping into aesthetics. Like, are you really interested in aesthetics, or you are really into the point where it is lucrative, where you can make money? And I'm like, all right. So my question to these people who are jumping into aesthetics would be like, why am I paying you the same amount of money to do a aesthetic procedure where I can pay someone who's 20 years in the business and is very, very well versed with the techniques and procedures? And why am I paying you the same thing? Why would anyone do that? And in terms of aesthetics, there are a lot of people who fly in from Bangkok, from Philippines, from a lot of people, even who are non-medical personnel, who are doing it hush hush behind, and it's way cheaper than what the doctors are doing. So it poses a lot of competition in that sense, right? So yeah, that is a competition for the aesthetic part. But then it's still something which is niche. They found their ground. The others, if you are not doing something different, then it's going to be just normal GP clinic. It's going to be very hard. It's going to be like a small pool of people that you uh, uh, fish from. I mean, like that's the only bunch of things that you can do. There's a few things you're restricted, and you come under the jurisdiction of what the TPAs and the laws that they impose on you.
So I've spoken to quite a few GPs and they all mention the same thing: attracting patients, retaining patients, and making ends meet. So what are your thoughts on that?
Exactly. My question is, what are you going to do to keep your patients coming back to you? As in a good way. As in, like finding you to find a solution to their problems, right?
So why are your patients coming back to you?
Even my patients, I have patients who have been with me since maybe 2016, 2017 up till today. And if they have any issues, the first person that you call and ask or something like that is me. Even though if it's not it's a surgical related thing or whatever, doctor, like, the trust that they've built with them. It has to be a genuine thing that you build with someone, right? So it cannot be hush hush. It cannot be like 50 in, 50 out. Like you have to be 100% in. When you are going to advise someone, you have to be well versed in that field. You have to be someone who's very knowledgeable in that field. You have to up your knowledge. You have to be there. So a lot of things, when I sit down and talk to my patients, sometimes it's not even about their problems, but I might give them something else, like a dietary advice on what they're doing, what might be causing a problem, and not only like giving them. The thing is, they don't come to me for cough, cold, and flu. Once they go to cough, cold, and flu, I tell them they know that they can go to a GP clinic and get that done. But if it's like prolonged, it's something really bad, and then they probably might come to me, and then I think I solved their problem, or else they would have gone somewhere else. So my approach is very holistic, not very pharmaceutical. I might use. I'm not saying that I don't use pharmaceutical medications. I do. That's why integrative medicine is a part of functional medicine. So you integrate, right? You integrate with TCMs. You integrate with Ayurvedic medicine. You integrate with traditional herbalist, homeopathy. You integrate everything inside. That's how functional works. Actually, you have to integrate everything. So I might not be an expert in everything, but I do have people in their respective field that I refer to: a Bowen therapist, a chiropractor.
Join Disruptive Doctors. Oh, Disruptive Doctors. Impact.